What I would love to introduce the concept of is working with plastic surgery. So looking at cosmetic surgery and how lymph drainage therapy can really help with the results. So it's very common that when somebody's going in for cosmetic surgery, obviously we're looking at getting a look, an appearance change, and we're looking for improvement. So the last thing we really want to have is swelling. Swelling never makes anybody look good, and it never makes the results look as impressive. So before surgery, we can do some work even up to 72 hours before the surgery itself. We can do work to help decongest the tissue to make sure it's nice and clear and clean and has lots of good nutrients for that tissue as well as immune cells. So that's going to make sure that we're not looking at any kind of infection post-operatively, as well as getting really good clean incisional lines and making sure that when we have that final scar that it looks amazing. On top of all that, post-surgery, there are some amazing things that we can do to help get that swelling out as fast as possible and make sure that you're getting fresh nutrients and oxygen and water to your new skin cells that are having to create a beautiful scar. And that in turn will minimize the appearance of that scar. We don't want to have fluid sitting there putting pressure onto the tissue and causing, that scar to be pulled slightly apart or irritated. That makes a larger scar, and we don't want that. When we look at cosmetic surgery, we're looking at how can we improve the appearance. So we can work on somebody as close as 24 hours after their cosmetic surgery. We might not work exactly on the scar itself because we want that scar to heal beautifully, exactly as how that surgeon intended it to heal. But we do want to make sure that your lymph system is optimal and it's working at its very, very best. So we can work in other areas around the body, and that's going to help indirectly drain the tissue that has been worked on and has been going through this healing process and make sure that it heals to its best. Most often people are coming in expecting this to be a very deep, aggressive sort of treatment, and we see a lot of requests for deeper treatments, especially when it comes to liposuction. If we're looking at, Brazilian butt lifts, if we're looking at 360 lipos, if we're looking at tummy tucks, or even breast augments or breast decreases. And the truth of the matter is that there's no need to go deep. This should never ever be a painful procedure. You do not need to take pain medication before coming for a lymph drainage therapy session. There's absolutely no need for it. We are going to help your body maximize its own ability to move that fluid. We are going to help your body find natural ways to move that fluid. I'm not manually forcing the fluid through your system. We are never, ever pushing it out through an incision. We are helping your body drain it to the closest nodes so that the wisdom, the intelligence, the smartness that is your lymphatic system can move that fluid more efficiently. And your body can do it and will do it, but every time you have a scar, it's like it's a beaver dam. It's blocking the fluid. And sometimes it needs a little bit of assistance, and that is exactly what we're here for. So it should never ever be painful. And if you ever watch the videos or anything on YouTube, on the internet, etc., know that that's not lymph drainage therapy. If it's deep, if it's aggressive, if somebody's on the table and they're breathing through pain, that is not lymph drainage therapy. I'm very sorry to tell you that you are watching something that's very, in my opinion, barbaric and should never ever be happening. Lymph drainage therapy is light, it's gentle, and you will never be in pain while receiving lymph drainage therapy.